ever a doubt? Well, it was interesting. I was just a gentleman just showed me the headline from I think 2012, where the headline in the paper was, "Does Windsor need a mega hospital?" You know that this is. I'm so proud that we've reached this point today, where we, as a province, the government has absolutely committed to the investment necessary for creating a new hospital that will serve the population of both Windsor and Essex, and in addition to the importance of that new hospital to replace aging facilities, but also to provide state-of-the-art equipment and innovations and health services. But also the conversation is continuing, right? So to look at how to maintain health services in the downtown core, to look at what more we can do for mental health services and the possibility of creating a regional center of excellence for mental health that would be located at the TAFE4 campus. Did I get that right? Yep. TAFE4 campus of Hotel Dieu Grace Healthcare. So there are a lot of layers to this announcement, I think, today. But two things are sure. Windsor-Essex is getting a new hospital, and the government has committed to investing in it to make that happen.
Can you talk a little bit about the longevity of the urgent care in the downtown, this facility or something else?
Well, that's part of the conversation that we're having in the discussions between the ministry, the local LHIN, as well as the hospitals, is to look, and again, it speaks to what I said earlier about maintaining health services, those necessary health services that are accessible to those that reside in the downtown core. There are many downtown facilities that exist here in Windsor. So we're looking at how that they might be repurposed or how we can ensure that the necessary services are provided. So that will be the conversation, no doubt, that happens in the months ahead to determine what precisely those programs and services might look like.
Possibility of adding an additional urgent care either in the west or the east end to compensate for the geographic location of the current or the planned hospital?
Well, I'm confident that the partners that are working together and having the conversations and the discussions, that they will make the right decisions for the residents of both Windsor and Essex, and make proposals on that basis of what they believe is the proper health care in the proper place and of that highest quality.
Eventually we'll get to the dollars, and so this phase, what's committed to the area for this phase of the project?
Well, so we're committed to build, so through every phase. We've provided a planning grant, I think, of $2.5 million. We enhanced that with some additional funds a few years back. And, of course, now we're getting into the serious dollars that we are working, again, with the LHIN, the ministry, the hospital, Windsor Regional, but obviously with significant input and support from Hotel Dieu as well. We are looking at the programs and services that are required, what's required in terms of a build to provide those programs and services, and adding on to that what I've said earlier about the regional Center of Excellence for Mental Health, the downtown services. We will invest as a government the necessary resources to build what is required. So, and some of that we know, but some of that is still to be determined. And I think it's a critically important time as well that conversation continue in terms of other opportunities. And we're certainly open in the ministry I guess I'd phrase it this way: it's extremely important to me as minister and the Ministry of Health that we arrive at the best possible solution for the residents of Windsor-Essex.
We've heard figures like $20 to $30 million. Is that within the range of expectations when you look down to things as detailed as architectural drawings and site preparation?
Well, certainly it's a very detailed process, right? And to get from this to where you have those detailed plans, it can be a very costly exercise. But we're prepared we know that we will be supporting the hospital to be able to carry through the additional remaining stages, and we'll provide the resources required to do that.
Minister, we were in a dog race with a lot of other communities throughout the province for these dollars. How important was it that we as partners with the province, both county and city, were able to secure that 10% funding and know it was in the bank.
Well, that was critically important. You know, I think that from the moment, pretty well the moment I became health minister 3.5 years ago, I became aware of just how committed the residents and the leadership of Windsor-Essex are to this project, to this new hospital. That commitment and that passion, determination, makes a big difference, and certainly the financial commitment that has been made through councils to contribute the local component, that is critically important. It's also a very clear demonstration of the commitment. So for me, it was never a matter of if, it was a matter of when to be able to reach this announcement today. I was compelled by the evidence in terms of the need for a new hospital, and I was certainly compelled by the commitment of the local communities.
Well, I guess before today, it wasn't official. It was still proposed. It wasn't coming for sure necessarily now. That's what
So now, yeah, so now it's official. We've committed to funding it. We've set aside the funding necessary. So it's in our fiscal plan, is how we refer to it as a government. And I also announced today as well that the process has moved one big step forward into stage 2, which is important. It's stage 1 often takes a long, long time. Again, it's identifying those programs and services that are required and what you might need to be able to manage those programs and services. So to move on to stage 2 is a very important development, and that I was happy to also be able to announce that today.
And I didn't hear anything about the urgent care clinic or center on Crawford and University. I believe that there's a sign out there. Is that part of the plan as well?
So which one is that? Where
Grace.
the
old Grace, yeah.
Right. So that's part of the discussions that are taking place on going forward, right? So we've made the commitment to fund the health services required, including the new hospital. But specifically today I said, and deliberately, that we are now continuing and deepening the discussion with regards to maintaining health services in the downtown core. What that looks like, I don't know, and that's a process that's best led, and I have to say the community process that has been undertaken throughout this over the years with regards to the new hospital has been exemplary. I don't know if I've seen a stronger community process in the province, quite frankly. So that community engagement needs to continue. The leadership that have been involved at every level on the conversation thus far needs to continue that conversation and discussion when it comes to services for the downtown core. So I'm not going to predict or preempt or suggest what that might look like, because it's obviously these are recommendations and proposals that are best suited by those who are closest and have the expertise to determine what they might be.
Can you talk about the process moving forward, because you've talked about decision making and who will make those decisions? Does this all come back to your desk? Will it be ministry officials? Is the LIN involved? What is the process?
So there are a number of partners. So the entire health community, of course, in Windsor-Essex. There's a particular role that Windsor Regional has taken on by virtue of what's being proposed. There's the local leadership at the council's level that are all having input, again, alongside the community process. And then really it's a lot of hard work between the hospital and the LIN and the ministry. So it's kind of, it's not only, but there's sort of that triangle of partnership that I think David had mentioned, just the amount of time that certain people have put into this in the LIN, in my ministry, in the hospital, and the leadership, broad leadership here in Windsor-Essex. So it's really a continuation of that process. And generally speaking, you know, so I let that process unfold, because again, those are the best people to be able to determine what those resources and what healthcare should be built here. I kind of step in if there's any problems. Hopefully there won't be. And then at the end of the day, when it does come to me, generally speaking, it has the support of all of those partners as well as the community.
When you talked about the Center of Excellence for mental health care, in the original proposal, I think it was like 60 beds at the T4 campus. Is this something beyond that, or what exactly do you mean by a Center of Excellence for mental health care?
So again, you know, I don't want to get ahead of the process, but we've indicated our willingness as a ministry and a government to look at the possibility of creating a Center of Excellence for mental health that would, I think most logically be based at the TAFE4 campus. So now there has been some work done, but there will be continuing work to be done to discuss what that might look like in terms, from every perspective, in terms of bed capacity and other resources. But I think there's an opportunity with the expertise that already exists here to really provide something unique and substantially more what's the word, remarkable for Windsor-Essex to really actually with the purpose and the goal of developing a center of excellence and all that that entails. So I'll leave it to the experts. Some of them are here. You can ask them in terms of what that might look like exactly, but we're quite excited about looking at that.
Has that been done elsewhere in the province, or in the mental health care field in particular?
I think we have designated centers of excellence, but since I've become minister, I'm not sure if we have looked at the possibility of creating a new one, which is what we're talking about here.
You made a number of announcements, obviously, over the years. How did it feel to be standing up in front of the crowd that you saw today?
Well, great, especially with the band sort of ushering us in as well. Windsor's a very, you need to be proud, I'm sure you are. It's a very unique part of the province. There's a passion and commitment and enthusiasm that exists here, and I felt it every time I've been here, but that was certainly present today. So to see such a large group of people coming out, and diverse group, and to actually have David and others identify specific individuals who have been involved, some of them a long, long time ago, right, in the beginnings of this, but throughout the whole process, most of them pure volunteers. And so it really, I think that it was really exciting to, once again, be part of that and feel it and sense it, and that's something that Windsor and Essex should be really proud of, is that not only on the science side, like you have done collectively such a good job at stating the case, making the case for a new hospital, and all the programs and services required, but you've done an exemplary job with regards to the community engagement process, and then you have a wealth of talent and expertise and goodwill, some of it paid, most of it voluntary, that have just come to this challenge with such vigor, and here we are today really as a result of, I just said a few words at a podium, but all the hard work was done over many years by local citizens that just believe in contributing and giving back and providing the best, creating the best possible health care for Windsor-Essex.
There was a group in town had some concerns about the site of the new hospital, and making this announcement, say, is that issue pretty much put to bed? It's going to be where the site has been chosen, and
well, typically the ministry, we look to the LHIN and the local hospital to make decisions with regards to siting of new hospitals. There's an expectation, however, that there is a strong community process that underpins that recommendation. I'm confident that process was undertaken here in Windsor, but the ministry and the government, we're not in the business of site selection. We really look to local leadership and local experts to make what they believe is the best decision, and to do that through community consultation. But I think it's also important, what I referred to as well is, there's still a lot of discussion ongoing, right, in terms of whether that's looking at maintaining health services in the downtown core, the mental health services that I spoke to, that there are many opportunities in Windsor and in Essex, and it's our job, I think, collectively, all of us, to make sure that we avail themselves of those. So I think that conversation going forward, it may yield results that the community will see will even further strengthen what we're talking about in terms of the delivery of services.